Dr. Singh, thanks for joining us.
You're welcome.
Our topic is prostate cancer, and first rattle out of the box, what is the likelihood of a man developing prostate cancer over his lifetime?
It's about 1 in 36. There are about 240,000 new cases of prostate cancer diagnosed a year, and about 28,000 deaths. And the likelihood is about 1 in 36 that a man in the United States would die of prostate cancer.
Well, that's 1 in 36 chance of mortality. What's the chance of actually getting the disease?
It's about the same.
Okay.
Yes.
Okay. What causes it?
The short answer is we don't know.
Okay.
The growth, death, and division of every cell in the body is tightly regulated, and cancer occurs when one of those tight regulation goes out of whack.
Okay.
And there are about 60 genetic events, we think, that have to happen within a cell for that out of control division to take place. Prostate cancer is no different from other cancers in that respect. There is underlying genetics and abnormalities that cause that. There are, however, certain risk factors that can can predispose somebody to prostate cancer. And those include African American race, not completely clear why, greater than 60 years, and occupations such as painters, farmers, tire plant personnel, and folks that work with pesticides and also who are exposed to Agent Orange, folks who consume alcohol, and also high animal fat diets, meats.
How is prostate cancer detected?
There's several ways that it can be alerted. One is a blood test. Primary care providers usually check for prostate cancer through the PSA, or prostate-specific antigen. That's a blood test offered perhaps every 1 to 2 years. Sometimes we see these when we do a CT scan of the abdomen and pelvis for some other reason, and we see a large prostate. And then, of course, the ideal way or the final way to actually say if you have prostate cancer or not is to do a biopsy, a needle biopsy of the prostate.
You mentioned the prostate-specific antigen, the PSA test. Why has that test become controversial?
Well, it was the easiest test to obtain. You just did a blood test and you could measure the PSA level. And what we found out when we first discovered the antigen and we started using it, we had levels up to 4 was normal. And when you have levels higher than that, then one of two conditions could be the case. One is a benign, meaning not cancerous, but enlargement of the prostate, benign prostatic hyperplasia, or BPH. The other one would be prostate cancer. So we started using this test, and unfortunately we didn't know enough at that time, and we started overusing it, and we thought folks who didn't have BPH but started having PSA levels that increased, we thought that they had prostate cancer, which they did. We would go look for it, and we would find it, and we would treat it. But what we didn't realize is that prostate cancer is a slow developing cancer, and you could go 20, 25 years before you actually have problems from it. And most folks, remember, prostate cancer is seen more often in folks who are over age 60. And when you look at 20, 25 years, they usually died of some other cause and not the prostate cancer itself. And so about 25 to 45% of folks who really didn't need treatment for prostate cancer ended up getting it based on their PSA levels alone. And so that became an area of controversy, whether should we use PSA or not.
Okay. Well, what would be the impact if the medical community stopped using the PSA test?
So the pendulum swung to the other side.
Okay.
Folks said, well, maybe we shouldn't use PSA, and that was one camp saying that. And we've done studies and mathematical analysis to see that approximately 17,000 more folks would die, men would die of end-stage prostate cancer if we stopped using PSA, and that would be a year. So that impact is pretty frightening.
Okay. Prostate cancer, the symptoms. What are the symptoms to look for to where you start suspecting you might have prostate cancer?
Anything with the urinary system where you're having difficulty starting a stream or dribbling or having incontinence, having some blood in the urine, although that can be part of bladder cancers, and issues with the urinary system essentially would be symptoms, could be symptoms of prostate cancer. And again, as I said many times, those will be presenting in later stages.
Okay. If you have a prostate cancer diagnosis, how serious is it?
Well, it depends. It depends on the stage. Prostate cancer is staged from 1 through 4. 1 is where the cancer is contained within 1/2 of the prostate. Prostate is like a walnut-sized organ that's around the urethra, which is the tube that carries urine from your bladder to your penis. And if 1/2 of the walnut-sized organ is involved, it's a stage 1 or T1. If both sides are involved, it's T2, the next stage. If it goes outside the prostate, it's T3. And then if it goes to the lymph nodes or elsewhere, like bones or such, we call it a stage 4.
Mm-hmm.
So the seriousness of the disease would depend on which stage it was diagnosed at.
Okay.
And also remember, if it is a low stage, if you are older, then you may die of some other cause rather than prostate cancer itself.
Okay. Possessed of a diagnosis, how do you treat it?
Again, that's why I went over the staging, because the treatment is based on the stage. If the prostate cancer is contained within the prostate itself, that's generally a good prognosis. And we can treat the prostate either by surgically removing it, a prostatectomy. There are many ways of doing that. Or we can radiate it with radiation, external beam radiation, or implanting radiation beams in the prostate itself. And there are some other experimental methods such as ultrasound waves, high energy ultrasound waves, cryotherapy, etc. But we essentially take the prostate out if it's at low stage and it's confined to the prostate itself. If, however, the prostate cancer has spread to lymph nodes, then we would need to sometimes radiate the lymph nodes. But we would then at that point, taking the prostate out may not help the whole situation, so we would pursue chemotherapy.
Okay.
And there are other new methods that we've devised recently, a vaccine called Sipuleucel T, where we train the body's your own immune system to go after the prostate cancer cells. And
How well does that work?
It is, so far, it's the first of its kind. The immune system technique, and we've gotten, the studies show we get about 3 to 4 months of life extension by that, if you're measuring the result by that, and which is modest. In the group that this has been used or has been approved to use, that's a modest effect.
Mm-hmm.
But I think it's only the first of several to come.
Okay. Are there things a man can do to avoid getting prostate cancer in the first place?
Yes, so if you're one of those high-risk groups that I identified, based on occupation, etc., I think screening helps, especially if you have any of the symptoms we talked about. Then you should get a PSA test, have yourself screened by a digital rectal exam. That's the prostate exam that nobody looks forward to, by your primary provider, where they actually check the size of the prostate, and then if there are abnormalities picked up at that point, then we could further work that out.
Okay. What does the future hold with respect to prostate cancer treatment?
We've come a long way. As I said, the Sipuleucel T, the immunotherapy, was a breakthrough in terms of the entire scientific world, that we can actually utilize that concept. And since then, there have been other cancers where it has done better than it has at prostate cancer. There are a lot more targeted therapies that we're able to use for the cancer. It is one of the slower growing cancers. That's a plus point for prostate cancer. However, it is it takes up the largest share of cancers, newly diagnosed cancers for all men. About 25 to 29% of all new cancers diagnosed in men consist of prostate cancer. So there's a lot of work going on in that area to bring that number down.
Very well. Doctor, I learned a lot. Thank you very much for your time.
You're welcome.